Welcome back to another edition of the DAMY Vlog. My name is Dr. David Duizer. Thank you so much for tuning in. It has been a while since I've posted. You can expect more frequent postings from us over this summer, 2020. A lot has changed in the world. A lot has changed in our lives since the last time we posted. For now, without getting into much of that, I'd just like to share kind of what's going on with us, where we stand, what's next for us, and what's positive and exciting with both DAMY and our new company, which is called Noble. So if you're not familiar with us, I'm a naturopathic doctor and Amy's a holistic nutritionist, and we support people on their wellness journeys. We help them live optimal lifestyles. My clinical practice is mostly with people who are unwell, people who have a serious chronic disease diagnosis. We try to apply the holistic approach to improve their overall well-being. Amy's practice is on the nutrition and spiritual side of things. She has a holistic nutrition practice, and DAMY Health is her gateway to facilitating optimal nutrition choices for her clients. And then her foundation is in spirituality and in helping people reframe and reset their mindsets to support their overall well-being. So that's kind of like the package that we think we bring to the table in holistic wellness. And so, we're really excited about the things that we have to offer. And today I'd just like to kind of go through sort of what's new. April 1st, we purchased with my medical partner the clinic that I work out of, and so we own the clinic where I practice, and it's called Noble Naturopathic, and it's in Vancouver, British Columbia. However, we see people from all over the world for teleconsults and for phone consults when necessary. We have a general naturopathic practice, integrative care, functional medicine type practice. In this province, we practice primary care. We have prescription rights similar to the family docs here. And so we're able to run labs and write prescriptions and also do supplements, nutrition, lifestyle, exercise, and a series of other in-house therapies that we're offering. I'd like to share some of those with you today. This video, the purpose of this video is really just to get back into the swing of things, to share what's up with us, what's going on, and to show you guys some of the things that we're proud of so far. So Noble Naturopathic, we're Vancouver, British Columbia, doing telemedicine as well for people from different regions. But we have a very large practice. We have a patient list of over 3,000 people, and the clinic is very well supported. We feel like we do excellent work for this community, and we're excited to be able to provide that work in person now as of today's July the 2nd, 2020. But we had been doing April, May, and sort of the first half of June, just telemedicine and just phone consults. So it's really nice to get back into in-person consultations. At our clinic, we have a secure server for video consultations. So we have a secure medical video teleconferencing system that we use to do consultations with people online. So that's kind of how things go. So that's us. My background, if you're not familiar, I was a naval officer in the Canadian Navy. I went to our Royal Military College here, which is similar to West Point and Annapolis and America's Air Force Academy, similar to Sandhurst in the UK, and same types of educational institutions in different countries around the world. And then we all moved to Victoria, British Columbia, where I was a naval officer for a few years, and then went to naturopathic medical school. My foundation was Bachelor of Science in Chemistry and Psychology, transitioned into naturopathic medicine after my short career in the Navy, and 5 years into practice doing chronic disease management now, and running this practice and trying to support people in every possible way that I can. Today I'd like to share some of those ways that we're actively supporting patients. So let's see if I can get this system to work. Here, I'll just pull this up and we go just like this. Okay, so this is our new website. It's not fully done, but you can see it's noblenaturopathic.com. Let me see if I can get you some of the fun things that we do. Okay, so sort of the About tab. We've got mission, vision, our clinic, our team, our community, and some careers. Our career link for people who are looking to join our practice. Under services, we have a few things that I've mentioned so far: primary care, chronic care, telemedicine. We've got some other practitioners in our clinic, including a counselor that we recently added. We do intravenous and injection therapy. We do a lot of high-dose IV vitamin C therapy in cancer, for example. Supportive therapy for people needing to improve their overall wellness while they go through conventional care. So we make sure patients are following standard of care in this province, and then we support them with everything that is evidence-based, safe, and efficacious for their disease state and whatever prescription therapy they're using. We do acupuncture, IMS, and cupping. Like lots of physical medicine, acupuncture, IMS, cupping. We also do cold laser therapy, which I don't know, is it even on this link? Doesn't seem to be on this link. Anyways, cold laser therapy. We do sublingual allergy treatments, so sublingual immunotherapy. Instead of doing injection desensitization therapy, we do under the tongue, and it's very effective. My partner does Bowen therapy. We both do bioidentical hormones, BHRT. We do clinical nutrition, of course, including intermittent fasting, prolonged water fasting. We do lots of keto diets, lots of low-carb diets. We do lots of protein monitoring. We have a new medical aesthetics device, which I'll review with you. And for precision weight loss, we have a new metabolic assessment device. So a little bit of medical aesthetics, a lot of precision weight loss, because we offer metabolic assessments and these specific diet therapies for individuals. Some thermography and VR therapy. VR therapy I'm really excited about. And then, 50% of my time is spent doing integrative cancer care. So mostly supportive therapy, but also some interesting testing that can be helpful in tracking and giving people really, really, really good options for assessing their disease state. So a little bit of invasive therapy, including injections, IV vitamin C and IV DCA. Those are the two IVs I do most of. A little bit of mistletoe therapy, supportive immune support therapy. On the technology side, this is where I'm really excited. Okay, so the Pinoe metabolic device. We do resting metabolic rate and active metabolism testing in our clinic. We're also now doing metabolic training. So we're testing people, assessing where they can improve their lung capacity, cardiac function, posture, mechanical and mitochondrial efficiencies, and adapting nutrition and exercise plans to allow them to reach their goals easier. So for example, if someone has a low resting metabolic rate, then we're getting them to put on a little bit more lean muscle mass. If someone is looking to lose a lot of weight but is inefficient at burning calories based on their active metabolism test, then we'll take the steps required to improve their ability to burn calories during exercise. And we get enough information from this device to actually do that. So soon we're going to have a big screen on the wall where we can take the device we're using to assess and use that during treatment. So we can say, are you trying to do zone 2 aerobic training for 30 minutes? Well, let's put the device on, let's watch the screen, and let's have you exercise and get you into your specific zone 2 based on the oxygen you're pulling in and the carbon dioxide you're pushing out. So we know exactly when you're in zone 2, and we'll have you do that for 30 minutes, for example. So we can say, you did get 30 minutes exactly of zone 2 training and you burned exactly this many calories because we were able to assess how much energy you burned during that session. Really excited about that. So the next thing is virtual reality therapy. We do virtual reality therapy in anxiety and in phobias. So we put on the goggles and we put people into the worlds that would be most suitable to reducing the symptoms of their condition, working at getting towards the cause. So in anxiety, we're teaching mindfulness, and in phobia, we're doing exposure therapy. And it's so incredibly effective. We're using a company called Psious, 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 Psious Virtual Reality Therapy out of Europe, and it's so cool. And then a couple other things that I won't review today, but our medical aesthetics device, we do adaptive contrast, exercise with oxygen therapy, cold laser therapy, and we remove moles and skin tags with nitrogen. We're also doing ear cleanings and a bunch of other primary care type things that people want to pay for instead of going to walk-in clinics. So we're private primary care facility, and people just want to sometimes have their procedures done in that type of medical setting, and we support them in that. So we do nitrogen and we do ear cleanings. Labs. We offer basically any lab that's available in North America we are signed up for, and we offer if it has decent research and we think could be beneficial to the patient's optimal wellness. So for example, I really, really, really only like to do labs if it's going to change the treatment course. So for example, in allergy testing, are we just going to suppress histamine? Or are we going to find out which allergy it is and desensitize to it? Then if we're going to find out exactly which one it is, we need to do a test, of course. And that's where I really like these tests. Cancer, we do some tumor marker testing, circulating tumor cells. We do the Prenuvo whole body MRI, which is the top of the line scan for malignancy. Diabetes, we do CGM, continuous glucose and flash glucose monitoring, fasting insulin testing, which we developed, or which we test or calculate the HOMA-IR, the hemostatic model of insulin resistance. Digestion, of course, food sensitivities, leaky gut testing, SIBO, all the good stuff. Environmental, like phthalate, paraben exposures. We do genetic testing, so we take reports from companies like 23andMe and Ancestry.com, and we take the most evidence-based SNPs for lifestyle management so that we can give proper advice on lifestyle. Really, really effective testing and therapeutic approach. For the heart, of course, we do basic lipid panels, but we do a lot of extensive cardiovascular assessments, which are really, 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 really important. The most intense one we do is the pulse, protein unstable lesion signature. It's a hot plaque test. So basically, it's assessing for inflamed plaque in the cardiovascular system. We do all sorts of heavy metal testing, including blood, urine, and hair, hormone testing, top of the line, Dutch. We also do basic blood hormone testing too. We do free ketosis testing in the clinic. So we do every morning at 9:25. We do blood levels of ketones for people who are trying to keep into ketosis. So like a lot of our integrative cancer care patients, we have doing ketogenic diet, and so we're tracking to make sure they're there. We run all of the conventional labs through Life Labs. It's just our local conventional laboratory. We do stress and depression labs. So we do neurotransmitter testing and other assessments too, like for example B12 testing and folate testing, things that might be helpful in mood disorders. Detailed thyroid testing, including TSH, which is the most appropriate test, T4 and T3 only when needed, and a whole assortment of other things, including selenium and iodine and bromine and cadmium, and detailed thyroid assessments to try to get at the cause. Antibody testing, for example, a lot of people want to have their antibodies tested, which I support. And then vitamin and mineral analysis. We don't just do serum levels. So serum levels, of course, are, you can do serum levels, and that gives you a general idea of what's going on a day-to-day. But we also do red blood cell levels and white blood cell levels in the most advanced test. So lots of different things. We're going to do more videos like this and post them on the website. I haven't really filled out the conditions page yet, but anyways, we have on the patient page here, we have online booking. We do direct billing to extended medical companies here. So a lot of people have work plans that cover their integrative medical care. And so we do direct billing. And we also, so online booking, direct billing. What else is good? Yeah, lots of good stuff. We're actually signed up for all of the companies now. So people have been calling and asking if we do direct billing for this company or that company. We do all the companies, I believe, that are available in British Columbia. So that's exciting. We can also do naturopathic estimates. So if people want to know how much coverage they have, our team can support them. We've got a patient services team, and they help people. So this is our website. It's kind of a rough draft right now, but trying to do some blogs and talking about what we're doing throughout COVID, for example, and how we're keeping the clinic safe, and kind of our soft opening, which is just one person per room. Basically, we're encouraging masks, and our practitioners are wearing masks. If you want to get more information from us, you can go to our website, scroll to the bottom, and sign up for our newsletter. That's probably the best place to get updates about what's going on with Noble Naturopathic in Vancouver. Yeah, most exciting new thing for us, Pinoy metabolic assessments. This is the metabolism test. Check this out. Pinoy metabolic analysis, precision holistic wellness. Make every breath count. Yeah, it's a... You might be familiar with cart testing. I used to be called cart testing because they have this big device on a cart that assessed metabolism, oxygen in versus CO2 going out during exercise and at rest. Anyways, now we have this very small device that you wear as a backpack, so it can go different places, and you get this printout. You get a package for the result. I should do a whole video on this, but you get this printout with the package that says efficiency in all areas: metabolic efficiency, aerobic health, breathing and cognition, fat burning, muscle type, breathing and mobility, cardio fitness, and respiratory fitness. And then what you do is you take the training plan that we develop in conjunction with the team at Pinoy, and you follow that for 12 weeks, and then you retest and you see what improved. Along the way, most people lose weight. It's exciting. So on our page here, it's noblenaturopathic.com/Pinoy metabolic analysis. You go there and you'll see what to expect, what are the benefits, all the good stuff. And people can chat with me for 15 minutes to get more advice to see if it's appropriate for them. It's covered by extended medical because it's a naturopathic consultation. And so it's excellent. So I'm excited about it. So that's what's new and exciting with us. Now let me see if I can do this next one. What I want to review next, people ask me all the time during COVID, how do I stay up to date with good information, with quality information? And I'd like to show you my process. Okay, so this is my process. How do we stay up to date? It's a difficult time because there is just so much information out there about this condition, which is COVID-19 and the virus, coronavirus. And so I totally understand the confusion that people might have, and I'm trying to be the most rational voice in the room every time I'm in the room, which means understanding where people are coming from, sort of where they're getting their information, what that information actually might mean, and that I'm trying to stay up to date on all the different types of information that are coming out, good studies, bad studies, good reports, bad reports, so that I can provide an adequate analysis for people and come from a real grounded state. I have a very conservative outlook, and I think that really is the most appropriate approach right now, is to be the most conservative you can while still trying to have the highest quality and the highest quality of life that you can possibly have. And so I understand that it's extremely difficult to live in the type of lockdown that some people have had to live in, and I completely get that. And for those who are trying to get away from that, I understand all of the things. All I'm trying to do is really give people the most information so that they can make the best choice for them and their families. So here's kind of my approach. I'll share my screen with you and you can see this is kind of what we do. So you're going to go, open your browser. Okay, and then you get to Science Daily, and what I like to do is just take a scroll down and see what's new. I go to Top Health first. You can see I've clicked here. I usually just click the one I'm most interested in. Click this. And then, okay, so here's the title. COVID-19 causes hyperactivity in blood clotting cells. Okay, so that's the title. But what I like to do first is see sort of where is that coming from, University of Utah Health. And then to find out the journal, you scroll all the way to the bottom, and you'll see the journal reference. You can see this one here is from the journal called Blood. It was posted in 2020. The journal Blood is an excellent journal. So you click this, and it takes you to the actual journal article. platelet gene expression and function in COVID-19 patients. So it's really, really important to go to this page and read their abstract and their notes, and possibly the entire article. So the layman's, mostly layman's description, or a rewritten description of the article is posted on Science Daily and other curator sites, and these sites that curate journal articles. They're excellent, and they can help you stay up to date really, really, really efficiently. I like to use Science Daily, but I use a few other ones as well. I like to read the summary, and then I like to go right to the article to see from the actual journal to see exactly what's going on, what type of study it was, how many people were involved, and get as much detail as possible. So that's my process. So for example, in this one, I'm really interested in clotting, the clotting cascade in COVID, because of the reports about cardiovascular implications of the disease. And so this one really, really interests me. That's kind of my process. And you can spend a lot of time reading the actual journal. So SARS-CoV-2 induces robust gene expression and functional changes in platelets. It functionally changes the platelets. Platelet hyperreactivity may contribute to the pathophysiology through increased platelet to platelet and platelet to leukocyte interactions. So it upregulates the interactions, which stimulates the clotting cascade, which is super dangerous for those who are already at risk of a cardiovascular event. So anyhow, this is how we stay up to date. This is a really, really, really easy approach that can just take a few minutes. For students out there in the naturopathic world who are looking to say, okay, what can I do to make sure I'm up to date on things that I'm interested in, or things that are applicable to my practice? Well, you go to a site like this, Science Daily. I think there's another one called Medicine News Daily, that are curators of journal entries, and you can usually sign up to a specific category to get an email. So for example, for I think it's functional wellness, or functional medicine. I think Science Daily has a functional medicine category or an integrative medicine category. I'm signed up to get that email every morning. And so it comes up and I click it, and then I can immediately pull up the journal article and read the abstract and see, was this a human trial? Was this an in vitro trial? Was this a meta-analysis? Or was this simply a case study? Was it epidemiology? Was it a double-blind placebo-controlled trial? What exactly was it? And then make my own judgment about their conclusion. And that's how we stay up to date. And that is really, really, really important, because now more than ever, patients are looking for details. They're looking for, what is the evidence? What is the quality of evidence that would support this treatment I'm going to undertake? And so you need to be very, very open with them about how much evidence there is, and what the quality of that evidence is. So, for example, what percentage effectiveness can we expect from this therapy? And in what size of study are you getting this information from? That's really important, and that's the kind of detail that I'm trying to gather for all of the treatments that we use, so that it can be made readily available to people, and so that confidence for patients, confidence for families, confidence for integrative practitioners that I'm working with, and for the conventional community can be extremely high. We do the same thing. We work in team settings often in my practice, and we send a lot of medical reports to the conventional side. And so in doing that, we're often referencing why we've chosen to start a specific prescription, for example. If we're doing some teamwork with a patient, and they have a primary care provider that's in a different profession, maybe they're a medical doctor, and I'm the naturopathic doctor making a prescription choice, then of course I'm wanting to provide supportive evidence for that prescription choice. And so in the letter to the conventional side, that can be very helpful to have, and I think it's often appreciated. And that's kind of my approach. I hope that provides you some benefit. Anyways, a couple things we're excited about moving forward as we get sort of back to almost regular life for the summer. The top one that I'm interested in is adding that metabolic therapy and metabolic assessment to practice. The American Heart Association has said that VO2 max is the new vital sign. So we have respiratory rate, heart rate, blood pressure, and we should have VO2 max for all of our patients. At Noble, we are now able to determine VO2 max on the treadmill, bike, and elliptical, whatever the patient would like to do. And that is a measure of health. It's a measure of overall wellness. And so we add that to their plan. We know their blood pressure, we know their heart rate, we know their respiratory rate, and then we also know their VO2 max. In our clinic, of course, we have a pulse ox, so we also know their oxygen saturation. But VO2 max is really important. So we have a lot of people who are not trying to lose weight. They're just trying to become as healthy as they possibly can. And so they're just coming in for VO2 max, and then they're doing the required training to improve that and coming back 12 weeks later to assess their VO2 max. It's so awesome. It's so very specific to them and their optimal wellness and longevity. So really, really excited to be able to provide the Pnoe. If you want to learn more about the Pnoe device, you can just YouTube it and watch some of the Pnoe videos. That is the device that we have, Pnoe. Or you can go to their website. I think it's mypnoe, mypnoe.com. They're out of Silicon Valley and I think Greece. And they're very, very cool. It's an excellent company. I'm really proud to be a part of it. That's the DAMY vlog for today. Just a quick update on what's going on, and really to practice with the new system we have here. We'll do more of this type of thing as we move forward and add more content and more value to you as a valued subscriber for our channel. So thank you so much for watching. I hope you have a great day, and we will see you next time. Please subscribe, like this video, share it with people if you want to sort of get our holistic integrative message out. We're trying to really, really, really promote the foundational principles of naturopathic medicine. Part of that is prevention, part of that is doctor as teacher, and that's why I'm here. That's why I'm going to be on this camera more often, and I'm just going to continue to try to provide you as much value as I possibly can. So that's enough for tonight. I hope you have a great evening, and let me know what types of videos you'd like to see in the future. Thanks for tuning in, and have a great day.